Hi, my name is Christa Gianfrancesco. I am a fifth-year dental student and public health dual degree student. Applying to dental school, I knew I wanted to do a dual degree. I was really interested in public health and looking at oral health from a population standpoint. So when I was researching dental schools, having a school that also offered the dual degree was really important to me. The most challenging thing would be, we have a finite amount of resources and trying to make them accessible and to deliver oral health to so many people with only a finite amount of resources. And I think that, to me, that always seemed like the biggest challenge and the most complex puzzle. So I was interested in studying that. Yeah. So after speaking with Dr. Ahluwalia, she connected me with the medical director, Dr. Prasad, at the Indian Head Injury Foundation. And they were interested in interprofessional collaboration and expanding to oral health care for their population. So for maybe 4 or 5 months before I left, we designed this needs assessment that would be able to work with their existing healthcare structure to start looking at oral health and determining what their clients knew about oral health, what kind of experiences their population was having. So mainly it's people who have traumatic brain injuries, but also developmental neurological deficits, so children with cerebral palsy, autism. It's a really large spectrum because there aren't that many resources there. So when I went, I did in-depth interviews with a lot of the caregivers to see what their experience with oral health and dental care had been, and from there we've been designing interventions that work with their existing system to try to educate more people about oral health. So when I first got to New Delhi, I went into one of the hospitals there and also a health clinic. And I think it was interesting because it was something that was completely different. I was in a different environment, but then also something really similar about parents are really passionate about learning about oral health. And it was clear that there were a lot of needs. A lot of people have no real oral health education, oral hygiene education. There's a lot of misconceptions about pediatric dentistry and the need for a child to go to a dentist. But I think the enthusiasm of everyone to learn more about it and to figure out why it was there was really, really exciting and really encouraging. In some ways, when there's a lot of need in an area, it can be a little bit, it's like a sinking feeling, sort of. There's so much room for improvement, but at the same time, seeing how excited people are about oral health, which is something that not a lot of people get excited about, was really encouraging. I am excited about oral health because it combines so many different aspects of health and well-being. So there's definitely a social aspect of dentistry and oral health. People see your smile communicates so much to someone, and your facial expressions. And then there's an economic side to it of, I think a lot of times it's easy to take for granted having a full set of dentition and all of your teeth when you're applying for a job and things like that, as well as pain and well-being. Oral health is linked to so many systemic conditions, cardiovascular issues, diabetes. So to me, it encompass the social aspect of life, and then also science, which I'm interested in, and working with people. That's why I'm really interested in dentistry and passionate about oral health. For me, the section of population oral health has really been a home base. I've had so many opportunities to experience a lot of different aspects of learning about oral health, of connecting with different people across the country. For instance, Dr. Edelstein has a lunch group that we do Skype sessions with different oral health leaders from all over, and it's not necessarily just dentists, economists from the ADA, deans of different dental schools. So it's been really like a home base for me.
What do you think is population oral health? What is population oral health?
It's so difficult to define what population oral health is because it's so many different things.
her as a mentor?
Yeah, Dr. Kavita Alawalia has really shaped my experience at the dental school, and there's this core curriculum that everybody has access to, but her one-on-one mentorship has really given me so many opportunities that I never would have experienced without her support and guidance. I've gotten to participate in projects in Nairobi, Kenya, in Delhi, India. I've worked on a collaboration with pediatricians and dentists in Uganda. I think these are experiences that I would never have gotten without her support and guidance. I expressed maybe my second year of dental school that I was interested in global health, and from there it's been great. Yeah, she also encouraged me to apply kind of outside of Columbia, but for the Consortium of Universities for Global Health for their Trainee Advisory Committee. And it's something I never would have known about if she hadn't told me, but encouraged me to apply and supported me developing my application. So now I'm a member of their Trainee Advisory Committee for 2 years and have started working with other students and residents from multiple universities and learning more about what other schools are doing with global health. So it's even that step beyond where once I graduate, I'll still be part of this group and continuing to work in global health. Next year, I will be a first-year resident, a pediatric dentistry resident at the medical center. I'm really excited to be starting the next step of my training and to be doing something new, but also with familiar faces. After finishing dental school and residency, I hope to be able to combine a lot of the different things that I've learned. I would love to continue to do research, especially global health research. I also want to practice. Didn't work on those hand skills for so many years not to practice, so I would love to work one-on-one with patients in a clinical setting, maybe in a community health center. And then I'd also like to continue doing research and maybe one day teach, but I haven't fully decided. If anything that dental school has taught me is that you never quite know what's in store and what experiences and opportunities that you'll get, and I hope that I continue to be as lucky in my career that I have been during my education. I think starting my first year of dental school, I would have never expected to have all of the different experiences and opportunities that I've been given. Definitely that idea that life's a journey. Education and dental school has been a journey, and I never would have guessed that I would have gotten to go to all of these places and meet all of these different people. A big thing for us is being able to lean a patient back, and he was someone that you couldn't lean back. So I remember feeling overwhelmed about that, and then I've continued to see him over the past 2 years, and from day one, being able to finish this case that seemed so overwhelming my first year, and seeing myself grow as a dentist, also our relationship for a patient who initially wasn't coming to a lot of appointments, to a patient I was super reliable, that I had a connection with, and felt like I improved his life not only by being able to give him some oral health care, but also like a consistency was really great. This is not popular in dentistry, but with Dr. Edelstein talking about different payment models and moving from a fee-for-service model, which we do now, where you pay per procedure, so you'll pay for your filling or you'll pay for your crown, to moving more towards a value-based system where we're reimbursing and paying for oral health, has really shaped my ideas of how I want to practice in the future, and kind of given me just looking forward to how oral health and dentistry is going to change in the future. I think that value-based payment and paying for outcomes, it's a scary idea because it's really judging you as a clinician in so many different ways. Not that you can just do a filling or that you can do certain procedures, but that you're looking at taking responsibility for someone's overall oral health, and in that way having to work with all different sorts of providers, that really having to be interprofessional, working with social work, working with nutrition, working with nursing, physicians, just that in order to produce overall healthcare, that everybody has to be involved. So in some ways it's a scary concept, but I think that's where the future is. And one of the most interesting ideas that I was exposed to during dental school was from Dr. Edelstein, that dentistry is really moving from fee-for-service to a value-based system. So instead of being reimbursed for filling or reimbursed for a crown, we're really moving towards being judged on providing overall oral health care to a person. And for me, I see this really shaping the way that I practice, the way that I think how dentistry will move in the future. And it's a big challenge, but I think it's going to ultimately be best for patients and for providers in the future. My advice to future students would be to just go for it. I found that my best experiences have been when I've gone out of my comfort zone and contacted that lecturer who came and spoke about a subject I was interested in, sent that email, gone on that trip that I might have been a little nervous to go and do. That I've never regretted making the effort, and that would be what my advice to someone would be.